Yeah, Bill, Candace, we'll start with those numbers. The Virginia Department of Health reporting that as of this morning, 16,901 cases of COVID-19 have been reported and 581 deaths. Meanwhile, the Virginia Hospital and Healthcare Association reports right now 1,431 people are in hospital, while 2,196 have been treated and released. Meanwhile, at the governor's news conference this afternoon, he went through where Virginia stands right now with testing capacity and their personal protective or PPE equipment supplies and how they will be improving in the next week. For PPE, Northam says the federal government has sent them 3 machines that will be able to clean masks for reuse.
Once all 3 units are operational, we will have the ability to decontaminate up to 240,000 masks in the Commonwealth per day.
While for testing, officials say they've been hitting the 5,000 a day mark recently and expect that number to grow as they sign contracts with private labs.
To be able to increase our testing through the state up to 3,000 additional tests a day.
Officials say they want to get 10,000 tests per day to begin the reopening process, but add with the current increase, they are now encouraging doctors to expand testing to anyone who's showing symptoms of COVID-19.
Or if a healthcare provider deems appropriate to test someone that might be prioritized who's asymptomatic, but you could imagine could be a close contact with someone who is or is very high risk and is undergoing a procedure.
Friday also saw a revamping of the health department's COVID-19 tracking website, including new numbers that were questioned in the news conference. Among them, an increase in reported deaths at nursing homes from 118 to 311, and cases rising from 875 to 1,537. The head of the nursing home task force offered this as a possible explanation for that one-day increase.
Sometimes there is a lag in capturing that and entering that data. I'd have to go back to the team to fully understand that jump, but that's what I think it's likely to be.
Now, officials also touched on another stat that saw a big one-day jump, and that is the number of tests reported. It was reported today nearly 15,000 tests in a one-day period. That's about 10,000 more than the previous one-day high. And officials say that the reason for that jump is because they're changing how they report and track tests, report tests going forward. Previously, one person, no matter how many times they were tested, would count as one test. But going forward, it's going to be every single test is counted and posted on their website. They say they had been tracking those numbers already, and the 10,000 are just those old tests that hadn't been counted as standalones. But again, going forward, each test will be counted and posted to their website. And they say they're doing this because it's going to give them a better vantage point of the number of percentage of positive tests, which is one of the metrics they need to begin that reopening process. And regarding that process, Governor Northam says on Monday he'll be laying out in greater detail how that will go, and also regarding his executive order that has closed many businesses in Virginia that's set to expire on next Friday. And I'll talk about whether or not he'll need to extend it or allow it to expire. Working for you at the state capitol, Cameron Thompson, CBS 6 News.